Hi, I'm Amber Kylick with Critical Movement Coaching, and I'm here today to show you an exercise that we do in critical alignment called the double strip. So what it does is it helps bring you into your positioning for your upper body, okay? And a lot of times what goes on in our upper body tends to trickle down into our lower back. Everything's connected. So let's get into that upper back and give some release to the shoulders, the neck, the upper back, and find a little bit better positioning, okay? So I don't like using the terms alignment and posture because really our posture, your best posture is the posture that you're comfortable in for the moment. We change all the time. Movement is what we want. So what we want to do is find that comfortable positioning, okay? My comfortable positioning as I sit here is pretty much right here. I sit like this sometimes. It's okay, 15 minutes a day, totally fine. So let's get on with this. This double strip is gonna go behind you. The fold lines up with the top of your head, okay? What you're gonna do is lower yourself down ever so gracefully until you're laying on it. Now, do quick check. Both ends of the strip are stacked one on top of each other. So you can take your hands behind you, and my strip's a little wonky, okay? Line them up. We don't want them off to the side like that, okay? From here, it's a matter of relaxing. Now, I could just tell you to relax, but that doesn't work out so well. So what I want you to do is pay attention to your breath. Heaviness with the exhale, that kind of melting sensation of feeling the ground supporting you. And not just feeling the ground support you, but feeling the strip support you as well, because it's supporting your spine, your skeletal structure, okay? And we hang out right here. Now, there's balance in everything. So if we want to find this heaviness with the exhale, we want to find some space and lightness with the inhale. So what we want to do is take our hands to the belly and just feel how you have a belly breath. Okay, that's the first part of your inhale. Second part of your inhale is up through the side ribs. So we want a belly breath and then up through the side ribs, expanding. Now, I want your ribs to expand, not rib cage lift like this, okay? That's not what we're looking for with the breath. We want expansion. The third part of the inhale, as we finish our inhale, it comes right up underneath the collarbones. So we have first part of the inhale, and you can consciously break this down, but be aware, this isn't how I want you to breathe all the time. It's just while we're doing this and paying attention. Belly breath, side ribs, collarbones. And that's a full inhale and then exhale. Now, also with that full inhale, it's not a full inhale that you can find. We're always playing on the edges, those whispers of sensation, okay? So we hang out here, pay attention to the breath. Does the exhale help? Does the inhale help? How do they connect to how your body feels? Always just play with it, okay? Now this is the first phase, relaxation. By all means, push pause, hang out here for 5 minutes, maybe 6 minutes, maybe 7 minutes. We want to feel that the body is getting into that kind of heaviness release aspect. Okay, if you have some sharpness somewhere, if you have some niggling thing that just doesn't want to let go, don't overanalyze it too much. But don't worry about the movement until you start getting into that sensation of relaxation. Okay, once you do, we're going to create some movement because what we have is relaxation, movement. The movement that we do is bringing the arms up, thumbs touch, elbows straight. You can reach up. Your shoulder blade, your scapula does move to reach up. But what I want you to do is just feel that the arms are plugged into the shoulders, not pulling back, just plugged in, and play with that. And what you're going to do is start to move your arms over your head. You might get to about here before you feel a whisper. Listen for your whispers, not the screams. It's not about touching the floor. It's that whisper of sensation as you move, okay? This is the movement. We're looking for this movement happening at the shoulder joint. As we move, the brain loves to take the easiest way, and your rib cage, if you watch my rib cage for this one, the arms are going to move, the rib cage is going to move, and we get into this pattern. Nothing wrong with that pattern if you need to reach for something. It is an available movement pattern. However, for this exercise, I want you to focus and pay attention to keeping these ribs soft, not gripped and holding, okay? Just soft and here. See where your arm goes when the rib cage doesn't, okay? Now, it's not about touching the floor. Get that out of your head. Doesn't matter if you touch the floor. It's not going to give you enlightenment. In fact, if you do touch the floor, there's a good chance, unless you're hypermobile, that your rib cage has lifted. I don't even know if I can touch the floor, okay? So you end up in something like this. My arms might be here, your arms might be here. It all has to do with your shoulder joint ability right now, okay? Work on it. Your body adapts to the loads and movements that you put on it. So movement is good, okay? We're here, we're just moving. This is our movement, okay? Now, take your hands back to the floor. If your fingertips are going numb, take a little rest. If there's a bit of tingling, that's okay. There's a nerve and artery that come from your neck down under your collarbone into your arm. And if you're holding a lot of tension and gripping and bracing up here, you'll feel it when you move your arms, okay? Just keep practicing. Eventually that starts to let go. You find a little bit better positioning for your body. Hang out here. We're going to end here. Roll off of this. Do not sit up. You reach your arm across. You roll shoulders, hips, and head all at once. And then you can come up to seated. When you come up to seated, okay, take your strip, sit on it, and just notice your positioning, okay? It should feel like it's pretty easy. There's a little bit of wobble there. You can kind of wiggle yourself around, and it just feels nice. Slouch a little bit. Oh, you can feel those little whispers, okay? Come back into that positioning. Now this goes for however you're sitting or standing. If your body starts to have those little whispers, those niggles going, we're not comfortable anymore, shift position. That's when you shift position, okay? Stand on one leg, stand on the other leg. Sit with your legs crossed, sit with your legs straight. Move your arms, move your shoulders, rotate a little bit. There's so many different positions you can sit in, okay? So play with that. Let me know how it goes, okay? This is a great tool to have. If you don't have it, you can reach it. Critical alignment therapy props, okay? Other than that, enjoy the rest of your day and don't forget to breathe.